Evolution, a deliberate yet subliminal process for all but humankind. We cannot wait.
It's one small step for man, one giant leap for mankind.
He's on the move.
Hello and welcome. Coming up, two recent breakthroughs made by Cambridge scientists in the field of antibody research and engineering could vastly improve the way scientists fight and cure disease. One researcher has spent 25 years discovering how to manufacture limitless human antibodies in a test tube, a technique regarded as unattainable by the scientific community. Another Cambridge lecturer has just seen the invention of a new cancer treatment in which he played a major role, finally approved for treatment on patients. And in the 17th century, Galileo turned his telescope on the sun and recorded how its surface constantly changed. Today we're learning more and more that eruptions on the sun can affect the Earth in many, many ways. And we've come a long way since the Wrights faced the dunes and winds of Kitty Hawk with their first gliders. This gave people the promise of a future in the air that has closed the world around us. And no two people are more than a day or two apart. But first, the Royal Victoria Hospital in Belfast became famous for caring for the victims of the bombs and bullets on both sides of Ulster's 30-year-long civil conflict. But besides developing pioneering methods of treating trauma injury, this large teaching hospital has developed new treatments in fields like cardiology and infertility. The hospital has seen all the horrors of the Troubles. But today, ambulances bring fewer gunshot injuries and more everyday medical problems through the gates of this busy teaching hospital. Cardiology is a particular specialty here. Today, cardiologists are using a non-invasive method of treating children born with what is commonly called a hole in the heart. It's a communication between the right and left sides of the heart, which are normally completely separated from each other. But if there's a hole, then an admixture occurs. Major open heart surgery is the usual way of closing up the hole and restoring normal blood circulation to the child. But doctors at the hospital are now using an inflatable device made of a special metal that can be molded to the size of the hole. It's pushed up into the heart through an artery in the patient's groin, avoiding any opening of the chest. They're out of hospital in 24 to 36 hours instead of a week. They don't have the risk of a major open heart procedure, and they have no scar down the middle of their chest. They simply have a band-aid over a small puncture mark in their groin. The maternity hospital houses Northern Ireland's regional infertility treatment and research unit. In progressive clinics, couples are treated together. An analysis of a male's sperm sample will show whether or not the man is likely to be fertile. That process starts with the semen sample being analysed visually to see how healthy the sperm are. The sperm are examined on screen and their pattern of movement plotted. The number of motile sperm is then calculated and compared with the norm. If there are few strongly motile sperm found, the couple might be advised that standard in vitro fertilization might not work. Instead, they could be advised to try the method developed over the last decade. This involves injecting a single sperm directly into the egg to produce a fertilized embryo, which is then transferred to the womb. For men who can't produce any sperm, a method developed by the team is holding out new hope. This test, which reveals the quality of the DNA of individual sperm, could hold the key. A long comet-like tail shows the sperm is fragmented and of poor quality. The problem of diabetes in the population is one that is causing particular concern. Over 45,000 people have the disease and the problem is growing. Diabetes damages the circulation and can cause severe foot problems, sometimes resulting in amputation. 60% of amputations in Northern Ireland are for injuries caused by diabetes. To counter the problem, the hospital has set up an education program aimed at young diabetics attending the foot clinic. Wound care nurse Jeannie Donnelly runs another program aimed at preventing avoidable disability. An audit of patients coming to hospital with wound problems showed each had suffered with an unhealed wound for an average of 4.5 years, some far longer. After attending the wound clinic, 70% had complete healing. The rest referred to specialist treatment. The Royal is about to get a new home. The £74 million hospital, nearing completion on the same site, will replace the old and drafty Edwardian corridors and wards. One way in which the Royal acts as a hub for medical services is evident in the Children's Hospital. The paediatric heart specialists at the Royal are putting their expertise online to regional hospitals using so-called telemedicine. If a baby is born with suspected heart defects in a hospital 100 miles from Belfast, doctors there can send ultrasound images of the baby's heart in real time to their colleagues in Belfast. The experts can give their diagnosis immediately and advise on treatment. The idea was tried with one regional hospital in 1995, but it has now been extended to more centres with promising results. With this kind of technology, the distance is not really a barrier, and in the future it's hoped to extend to hospitals that may even lie outside Northern Ireland. The production of human antibodies has long been a focus of scientific research. Human beings depend on the antibodies produced by their immune systems to ward off disease. Scientists and the medical profession use antibodies to diagnose illnesses and protect patients against disease. Until now, the only way to produce these antibodies outside the human body has involved the use of mouse cells, which are fairly toxic to the human body. At Cambridge University's Department of Pathology, though, scientists have helped invent a manufactured antibody targeted at chronic lymphocytic leukemia. It's a treatment that's just been approved for use on patients in the USA and is expected to achieve European approval soon. It's a project that's taken 10 years to come to fruition. The goal of solving an antibody puzzle that has bedeviled the scientific community for decades has just been achieved after 25 years of research. A quarter of a century ago, the creation of antibodies using mouse cells won its inventors the Nobel Prize. Now, thanks to a technique developed by Dr. Abraham Karpas, it's possible to grow any kind of human antibody in limitless supply. It's a breakthrough that has huge potential. Scientists now have to identify which of the millions of different antibodies fight which diseases. Since he made the discovery, Dr. Karpas has been besieged by scientists wanting to use his technique. He's optimistic that treatments using manufactured antibodies will be available soon. Some cancer organizations say the world should be able to look forward to the development of new, targeted cancer treatments much more quickly because of Dr. Karpas's groundbreaking technique.
One small step for man, one giant leap for mankind.
Weather and climatic changes, atmospheric pollution and disturbances of the ozone layer. Worldwide magnetic storms that disrupt radio and radar, telephone communications, and even cause power failure. All these may well be controlled by eruptions on the Sun, which affects Earth's magnetism and creates the auroras by means of a vast engine around the Earth, the magnetosphere. Because this magnetosphere can affect the Earth in so many ways, understanding how it works might help us cope with climate and pollution variations, and even help us in planning our food and energy resources. But how can we start to understand the magnetosphere? In 1600, William Gilbert told us the Earth was a great magnet extending into space. 10 years later, Galileo turned his telescope on the Sun and recorded how its surface constantly changed. But then, for 300 years, the Sun and Earth pursued their courses, and no convincing theory was able to connect Galileo's solar changes with Gilbert's terrestrial magnetism. Until a solar theory in 1890 suggested the Sun throws out particles which travel to the Earth to be caught in its magnetism. In the 1950s, the Sun's own magnetism, it was suggested, flowed into space to envelop the Earth and generate the auroras high in the terrestrial sky. Of course, this was only speculation on how the Sun might affect the Earth through an invisible magnetosphere. Only by getting an accurate measurement in space could the true facts be unearthed. In the late 20s, Goddard, the American, built the first practical rocket craft. The Russian Sputnik was the first space success. The American Explorer soon followed, carrying with it a Geiger counter. The signals produced by the counter enabled Dr. James Van Allen to confirm that he was recording something real but unexpected in space. It turned out to be the first discovery in space. The Van Allen radiation belts, particles invisible to the eye, which came perhaps from the Sun, were trapped in the space around the Earth by the planet's magnetism. This was the first step in establishing the link between the Sun and the Earth through the magnetosphere. The first concept of the magnetosphere was that of a region where Earth held particles that were captured from the Sun. But did these particles really come from the Sun? To find out, instruments had to be fired further out into space to really discover if the erupting surface of the Sun did throw out particles and magnetism all the way to the Earth. And from space, this answer came back. Streams of particles flowed from the Sun, dragging out the Sun's magnetism, a solar wind rushing into space. But Earth's magnetism in the magnetosphere deflected the solar wind around the Earth. So, how then could the solar particles get in and be caught? Solving this space problem could be difficult. Researchers discovered that by going above the Earth's poles, solar particles could be detected entering directly into the Earth's magnetosphere. While within the magnetosphere, further measurements showed what was also invisible to the eye: seas of plasma particles around the Earth and huge particle streams moving thousands of miles back from the tail, perhaps to directly ignite the brightest auroras. But what could drive the magnetosphere into these vast movements? Could the solar wind rushing past outside the magnetosphere supply the energy? One theory hinged on a magnetic connection, magnetism from the Sun connecting with and dragging back Earth's magnetism. This would work like a dynamo in space, transferring energy into the magnetosphere, where it's stored until suddenly released in a magnetic storm to disturb the Earth and create auroras. Such auroras appeared to be created when stored energy was released in a violent eruption throughout the magnetosphere. But where could proof of this be found? One place is the Arctic, for auroras can be seen almost every night, so scientists search for clues to show how the magnetosphere collected energy from the Sun, stored it, and suddenly released it to the Earth, creating auroras in a burst of energy equal to that of a large earthquake. So analysis concentrated on finding how the magnetosphere worked and, in particular, what triggered its energy releases. Could it be changes in the solar wind? To scientists, it seemed that changes on the Sun, which changed the solar wind, appeared to trigger an energy-filled magnetosphere into a sudden spasm, creating a magnetic storm, the brightest auroras, and affecting the whole Earth environment. Investigations continued. This is a computer simulation of the Earth and auroras from space. It was part of an experiment to measure exactly how magnetosphere energy creates them. And beyond that, there were active experiments. In Canada, radio signals which disturbed the magnetosphere were received from the opposite hemisphere of the world, the Antarctic. The signals received from the South Polar region arced through the magnetosphere to supply a record of the changes that were happening there. The most active experiments were carried by man in space, on the space shuttle. To help them understand space, scientists developed laboratory simulations of a magnetic Earth and the solar winds streaming at it, and were able to produce a visible representation of the magnetosphere. But the picture was blurred and out of scale. Only space measurements would be valid in constructing a true diagram of a magnetosphere and its movements. Simplified images of this complex engine in Earth's space showed activity in what until that time was thought to be only empty stillness. These images were a gauge of the understanding of those pioneer researchers and their ability to predict how changes on the Sun would in some ways affect the magnetosphere and the Earth environment. At forecast centers, it became standard procedure for the Sun to be kept under watch around the clock. Scientists realized that the magnetosphere was a complex engine through which the Sun caused enormous disturbances to the Earth's environment. They knew that by discovering all the details of how the magnetosphere worked, they would be better able to predict its effect on the atmosphere and its influence on short and long-term weather patterns and on changes in the Earth's ozone layer. It proved to be crucial research for mankind. We've come a long way since the Wrights faced the dunes and the winds of Kitty Hawk with their first gliders. Montgomery and Linlithgow before them had shaped the wind, but they opened a new dimension to flight. The Wrights developed an aeroplane with the power of a gasoline engine. This gave the promise of a future in the air that has closed our world around us, and no two people are more than a day or two apart. The initial drive to perfect the aeroplane came because of its uses in World War I. Speed, range, and carry capacity increased, and by the end of the war, the aeroplane became a tactical weapon of importance. Within 7 years, the first regular airmail delivery was started between Washington, D.C. and New York City. And the first passenger service covered the 13 kilometers between St. Petersburg and Tampa in a flying boat. Aviation was soon pushing the limits of speed, altitude and distance. Glenn Curtiss and his R3C racer, with pilots Cy Bennis, Al Williams, and Jimmy Doolittle captured the speed record. In the 1920s, the Atlantic was crossed many times, and in 1927, Lindbergh did it solo from New York to Paris. Wiley Post and his Lockheed Vega, the Winnie Mae, set altitude records as well as circling the Earth. The Vega became a record breaker for many famous aviators: Jimmy Matten, Roscoe Turner, and Amelia Earhart. The National Advisory Committee for Aeronautics led in engine and aerodynamic research. Howard Hughes, a leader for 2 decades in aviation, set a new transcontinental record in his racer, as well as a faster time around the world in a Lockheed Electra. Lincoln Ellsworth made Arctic flights with Emerson in the airship Norga and explored the Antarctic in the Norfolk Gamma, an all-metal skin-stress plane. Admiral Richard Byrd had pioneered polar flights in 1929. In the 30s, the NACA developed a series of modifications that further improved the highly advanced radial engines of the time. Engine performance under the research of NACA's Lewis Center kept pushing aircraft faster and faster, and soon the flow of air over the wing's surface became a problem. They were called shock waves, forming around Mach 1. The efficiency of the wing was disturbed. One of the first aerodynamic fixes was the innovation of the swept wing that minimized shock wave formation. The B-47, one of the first military aircraft with the swept wing, had a control problem. At high speeds, the nose would pitch up. The solution turned out to be a simple device on the upper surface called a fence or vortex generator. James Osborne of the Boeing Company was the designer. When aeroplanes approached supersonic speeds, the problem of wind resistance became enormous. The solution was to remove volume from the plane's fuselage near the wings. This so-called Coke bottle fuselage greatly dissipated wind friction. The NACA research program developed the X-1, and on October 14, 1947, Chuck Yeager broke the sound barrier. The Douglas D-5-58 Phase 1 investigated high-speed flight with a straight wing. Then came the Norfolk X-4 and the D-5-58 Phase 2 with a swept wing, flying transonic and supersonic speeds. The Bell X-5 provided research into wings which had a variable sweep, the Douglas X-3. And then the X-1A provided valuable research flights. The X-2 worked at altitudes above 100,000 feet and beyond Mach 3. The X-1E and the X-1B continued the step-by-step research into higher Mach numbers and thinner air. The next step, the X-15, operated in air so thin that normal aerodynamic controls wouldn't work, and a new jet-powered guidance system had to be developed. The X-15 became the latest gold standard. It was built with the most powerful rocket engine ever installed in a plane and was propelled to speeds over 6,400 kilometers per hour and to altitudes in excess of 250,000 feet. The forces generated were so great that pilots had to undergo extensive conditioning in specialized flight simulators to avoid passing out.
It's one small step for man, one giant leap for mankind.
Is on the move. That's cool.